Hello, my name is Hector Del Castillo, Chief Product Officer of Beyond and organizer of the Business Intelligentsia DC Meetup. I'm delighted to introduce you to Philip Simulus, CEO of Simtelligent, who will share with us how you can take advantage of cognitive and real-time analytics to get the most value from your data to improve the customer experience. Please help me welcome Philip Simulus.
How many people here are brand new to cognitive analytics and are here to just figure out what does that mean? Okay, it's a new term. So at least some of you guys have kind of had a little bit of experience, a little bit, you've read about it or played with it a little bit. Let's start off with a story, right? I don't know, does anybody recognize this lady? Does anybody have any aging family members? Mother, grandmother, aunt, uncle, but not uncle, right? Well, I guess it could. This is actually, it represents Hector's mom. And this is just a true story. Hector's mom got sick and went to the hospital, saw the physician who diagnosed her with pneumonia and said, okay, we need to give you some medication to get you better. So Hector's mom gets a prescription and waits, goes over to the pharmacy, number of hours goes by, she's a little bit old, maybe not thinking clearly, decides, hey, let me go to lunch, let me leave, doesn't get her medication, goes home, can't figure out what's going on because she doesn't have her medicine yet. She's on the phone trying to get a hold of the pharmacy, trying to get a hold of the people that are going to fill her prescription, and can't get through to the right people. I take it to mean that probably she's not as adept to phones and everything else that we are, right? So she didn't know who to talk to. She's getting very confused, getting very concerned, and doesn't quite know what to do, doesn't know who to turn to because she lives out of state, a different state. So Hector's not around to help her out, and eventually gets very disoriented. Falls asleep at night, wakes up the next day, just very confused, not sure what's going on. And what happens to elderly people when they start getting concerned, confused, when they don't know what's going on? They get scared, right? And they start making poor decisions. And so Hector's mom decided that she needed to go back to the pharmacy in a bad state of mind to get her medication. And fortunately, this was not Hector's mom's car. She actually somehow made it to the pharmacy, got the medication, and her story ends a little bit more happily than this story did. But this is very likely what could happen in a scenario where you have a confused, scared elderly person, just trying to make their way somewhere to get help. 93% of health plan providers say predictive analytics are in the future. Predictive analytics, sometimes depending on the context, is also synonymous with cognitive analytics. So 93% say this. Is this a number you would agree with? I mean, it's on the slide, so it must be right? Yeah, I would lead you astray. We look at cognitive analytics. What exactly is cognitive analytics? I've had a lot of questions on that recently, and I think that the answer really depends on how you see it or what your use case is. At a very vague point, we define it analytics on top of an AI engine. We include it with multiple interfaces like touch and voice. Really, when I was talking with my team, we're trying to kind of further define it. What we're going to show you later on is more, the AI portion of it. The cognitive portion of it is your data that is actually pieced together, or maybe let's say translated by an AI engine. So you have data that may or may not make sense. It may come from multiple locations. And how do you join disparate data in order to do analysis on it and make sense of it? And that's where the power of cognitive analytics comes in. And cognitive analytics is going to allow users to interact with their data, easier and faster, and it improves outcomes in business decisions. Does everyone here use traditional analytic tools? Cognos, ClickView, Tableau. Are you guys all familiar with these types of business reporting tools? If you don't mind, I'll ask a few questions throughout my presentation, please. I know a lot of times nobody wants to answer the first question, but feel free to throw out some answers. I'll start off with what I see as a couple challenges, sometimes with traditional analytics. Number one is it's license-based or seat-based. So a company may buy X amount of licenses to some software. And if you need access to it and they're out of seats, you don't get access to it. And also, 21% of seats was what is actually utilized. So you're looking at roughly only 1 out of 5 licenses that are actually used, while the other 4 out of 5 are assigned to somebody who doesn't actually ever use them. And then the problem comes up when someone needs answers or they need to actually view the data. they don't have the access to it. Does that make sense as far as what a challenge is? So some of the cognitive analytics solutions that we actually work with are data-based. You actually pay on the amount of data that you're actually, consuming and interrogating, so anybody in the company can actually have immediate access to answer questions. The story of Hector's mom could have went, fortunately we agree it ended well enough, but it could have went much more smoothly, and it could have gave Hector a lot more peace of mind. What if the physician could just enter in the prescription into the computer? Yeah, and I know these technologies exist, right? So far, I've had personal interaction with family and physicians where a medicine may be called in, from a doctor to a pharmacy, but there's no communication. You call a pharmacy, where's my prescription? They say, what prescription? Well, my doctor faxed it over. We don't have anything from him. Have you guys ever encountered anything like this? Okay, of course, a few shakes of the head, yeah, a few nods. So what do you do next? You call back to the doctor. Well, we faxed it. Well, please, can you fax it again? They're annoyed. They do it. Magically, it appears, and the pharmacy fills it, right? But it's a huge headache. So if the doctor had the ability to just send that prescription over electronically right to the pharmacy, what happens if Hector's mom, number one, knew how to use a tablet, right? But number two, she could just answer the question herself. When is my prescription ready? Where is it at? Where is it at in the workflow? 11% of health plan providers say they don't have the talent needed to develop applications. So I see. Well, maybe they may have elected not to. They may have elected not to say. I don't know. They didn't want to throw their team under the bus, but I agree the number is possibly pretty low. But they said to develop applications, and that could be loosely defined. That's how I see it. I've known a lot of application developers that probably need to turn in their development card, but I don't know. Not me, of course, right? But so when we're talking about the strategy, you use the word Craig, tactical. If you don't have a tactical leader, somebody who has their finger on the pulse, that knows where they need to be, ultimately what they become, CIO or a CDO without a budget becomes a scapegoat. Right? And I have to call it out. Somebody looked at this and said, "Oh, a goat?" And I said, "Well, it's a scapegoat. So it's different, a different kind of goat." But we're going to look at some different kind of case studies or different applications in a few different. We'll look at healthcare sectors, and we'll look in some of the different industries to see how cognitive analytics actually adds value, to the end user. And who is the end user? It may be a physician. Right, it may be somebody at home, maybe a customer of a retail store. So looking at the four healthcare sectors, we'll start out with healthcare services and facilities. Electronic health records, 83% of doctors are using electronic records. Agree? 70% don't. Okay. I've actually talked to some who don't. And the reason they say they don't is if there's an outage. That's the only reason I've heard so far is that they're not concerned. I mean, everyone's concerned about privacy. I typically don't talk about security as much because to me everybody's talking about security and we also agree with that. So that's not something that's a differentiator. They say if it goes down, right? If the network goes down, if the cloud provider goes down, what do we do? That's why they keep everything in a file cabinet in the back. So with cognitive analytics, so the ability to track patient health outside of appointments, or also reduce operational cost. So again, some of these things they are the to be. It's the direction that we're going, but they're not in place yet. Actually, one person who I know that gave me the ability to tell gave me permission to tell their story. They have a family member that has. I gotta remember to turn over here. By the way, I don't want to leave you out of the conversation. But he has some neurological disorder, where he needs to wear, every now and then, he has to actually wear a helmet for a period of 48 hours. And this helmet collects a lot of data. It's to monitor his brain activity and determine, why is he having seizures, when's he having seizures. So he wears it 48 hours while he's sleeping, while he's playing video games or eating and everything else that's going on. Where cognitive analytics, comes into situations like that is it's collecting, just like other IoT devices, it's collecting data, it's storing it into the cloud. Well, what if you now have the ability to, ask questions directly? So the use case where we see it is a lot of times a physician may have reports available to him, but those reports are available based on what somebody thought the physician needed or what physicians needed at the time. If they have additional questions they want to ask, this is where a search-driven cognitive tool becomes very useful, because a physician can now sit there and ask questions, and when it gets the answer, it could drill down. This physician can drill down deeper to understand, okay, what was going on at this time of day, and now with the cognitive engine behind it, it can look across multiple patients. So even though not a lot of people have this disorder, if you could now, instead of just looking at one person, if you could look at multiple people that have the same disorder to figure out, what's the commonality, what are the outliers between them, also looking at environmental factors. And as I mentioned this in this case study, one thing I'll bring up that applies to all the case studies, again, and what we're talking with cognitive analytics, though, is a lot of times used in tandem with traditional analytics. If we'll call it, Cognos, Tableau, we'll call it kind of traditional analytics. So we're not saying, replace it. A lot of times, companies have invested a lot of money in these solutions. But this is usually a supplement or alongside with type of technology. But has anybody ever encountered a situation where you need a new report, you need a dashboard, or just new information, and you have to put in the request to IT, and they gave you the report within an hour? How many people have seen that? Perfect, one. And the reason I asked the question is, in a lot of larger companies, I used to work at Blue Cross Blue Shield, and we had a whole backlog of dashboards and reports to build. And so the problem arises that somebody has a question, they have a need for a new dashboard, but they don't get it for literally weeks or possibly months. And so this is another area where a search-driven cognitive analytical tool comes in very handy. If there's a question that needs to be answered and nobody has access to provide that data, you can sit down at your desk and you could literally just type the question out, or ask Alexa what's for example, what we have enabled on here is just for a physician to ask simple questions like, how many patients have visited my office today? Things like that. Revenue. So pharmacies and technology increase revenue. Without going deep into digital transformation and what's happened to companies like Sears or Toys R Us or Blockbuster, you guys understand what happens when companies don't stay on top of digital technology. Would you agree? Companies make decisions that are, hey, this is the way we've always done it. Consumers have always wanted to do it this way. They're not going to want to do it some other way. My favorite story with Blockbuster is the 3 reasons why they didn't buy Netflix. If you guys don't know it, I'll just tell you briefly. The three reasons that executives, the smartest people in the company, said, hey, we're not going to invest in digital technology, is because people like to come to Blockbuster and walk up and down the aisles and pick out a movie. They enjoy it. They like the chance that they're going to run into a neighbor or friend they haven't seen for a while. And number 3 is my personal favorite. They want to come to Blockbuster. They don't want to stream movies because they like buying popcorn at the checkout aisle. No, there's so many companies that have just, gone on and just made bad decisions. Somebody had asked me in one of our earlier topics about Sears. They said, hey, will Sears ever come back? And my first answer was, yeah, they'll come back, but they're going to have to reinvent themselves. They're not going to be, the Sears that everybody knows. But, in digging in further, what we found out is that Sears had actually made, terrible financial decisions. Back, years ago, if you went to buy a stereo, the stereo was huge, right? It stood about this high, this deep, and they needed tons of floor space to show off, their TVs that were also this big and sat in a cabinet. They were signing 99-year leases on these giant buildings. Well, now, you go to Best Buy, they have the TVs all hanging on one wall, right? You don't need the floor space anymore. And they're locked in, and so, they have so many financial troubles. And, the reason I kind of segue a little bit into there, because this isn't, this is about pharmacies, but to me, this is about business. And, pharmacies need to reinvent themselves. They're not just there to sell prescription medicines anymore. And if they are, and a lot of mom and pop, pharmacies are actually upset because they're getting forced out of business. That's the way they tell the story. Are they getting forced out of business, or are they just not being strategic enough? Not everybody could be a CVS. So looking at pharmaceuticals, the Royal Pharmaceutical Society reported kind of 4 main points. That pharmacies need to shift focus toward providing more services. And I think as a whole, the healthcare industry is looking at how can they be more service oriented. They need to see helping people as the ultimate goal. Take initiative and drive change. So don't sit around and wait for a mandate to come. Don't wait for the federal government to say, hey, this is what needs to happen. Take charge and run your business, grow your business. And also collaborate with each other and other healthcare professionals. And how this works within cognitive analytics, Has anybody ever heard of a story, or hopefully not had this happen to them, where you get one prescription from a doctor, get another prescription from a different doctor, and they actually conflict. You have medical problems because you're taking two medications that aren't designed to work together. Tools like this allow physicians, actually pharmacies, to be able to make sure that whatever they're prescribing to you or whatever they're actually giving you, aren't going to cause any potential side effects, or at least clash with each other. So pharmacies need to become transactional-based pharmacies are clearly at a distinct disadvantage. If that's all you do, you're not going to be in business long. Just the same way the Blockbuster went out of business, and every other company we've talked about so far. Looking at medical devices, equipment, and supplies, some of the abilities with cognitive analytics now allows you to remotely monitor the status of implants. Years ago, my grandmother did this. Got a hip replacement. That hip replacement is going to last her until she dies. She's still around, fortunately. More and more, people are getting knee replacements. They're getting hip replacements at a younger age than they used to. It used to be, you get it when you're close to death and you last a few more years, and that was it. But now, people are getting them in their 50s and 60s. They still want to play tennis. They still want to go out and golf, and these implants are wearing out. So the ability, with IoT devices that are embedded in there, they can collect the data on the overall wear and tear of these devices. And now looking at cognitive analytics, they're making better business decisions to see how long these are lasting, determining the wear and tear, but not just on one patient alone, but actually get it across the board. Having the ability to eliminate false alarms and intervene only when needed. That's a big thing. Only intervene when needed. Having the power of, say, something like Watson Health. Most people at least have heard of Watson Health, right? Having the ability to consider not only you, but consider other patients that have similar circumstances. Being able to consider environmental factors. Things like your work environment, how active you are, and making decisions on when a physician actually needs to intervene. Medical insurance and managing care. Maybe this is the best use case overall, right? Because this largely affects us when we're paying our co-pays, when we're looking at our monthly premiums. But with cognitive analytics, the ability to reduce operational costs, prevent healthcare fraud, and improve overall patient outcomes. Healthcare fraud, by bringing that down, actually lowers the amount of money that we have to pay out of pocket. Does that make sense? It's the same thing with reducing theft at Best Buy or Walmart. Somebody always pays. In fact, one of my previous healthcare providers no longer offers medical insurance. And when I went to re-up the next year, they said, we don't offer that anymore. And I'm like, why not? There were a number of factors, but fraud was one of the factors. They said, look, you were paying this much per month, which is already way too much. And they said literally they would have to charge $2,000 more per month for their normal customers in order to, and again, this is only a piece of the pie, but in order to cover those who don't have insurance, but also, to recoup their fraud costs. So with the ability to be alerted immediately of fraud, when you notice that somebody has X amount of visits more than somebody in that area, looking at demographics, they live in a certain state, they live in a certain city, their gender and their overall health costs, you can see if somebody's having way too many visits. Looking at food manufacturing, and this is actually this case study is really based on a real world experience with a company that I work with that does food manufacturing. They make candies, for a very large food manufacturer, and it started out with just a conversation. They didn't know kind of what we could do or what somebody could do to help them, but they had a number of challenges. Right? We don't call them problems, right? Everything's just a challenge because it's solvable. But they said that, look, X amount of times a day, one of our manufacturing lines goes down. I didn't know what that meant, so I'll tell you guys what it meant, just in case there's somebody out there that doesn't know either. When the line goes down, the conveyor belt's still moving, but there's just nothing on it. Right? So when you're in the factory, you hear all the machines are humming and whirring, and you're playing Angry Birds on your phone, but there's actually no product being made. So the company was losing, tens of thousands of dollars every time it happened. And how many times does this happen? A few times a day. So initially it wasn't a problem to them until I said, but you're losing X amount of dollars per day. That was the aha moment. They said, well, what can we do about it? So what they wanted to be able to do is, number one, just have visibility. Are our lines on? Are they off? What is the temperature? Because one of the things that we noticed is that when the temperature in one of their operating rooms went up, the production actually went down. That was one of the correlations we were able to draw. And so we said, well, what other kind of correlations can we do? So the power of the cognitive analytics engines is that you can now, it's actually gathering insights. And so if you're doing searches on, if you're asking questions about, why is my line down at noon, and you're asking different questions, the engine actually understands what people are asking and gives additional insights saying, hey, you may be interested in these data points. You may also be interested to know, these things. So what we're able to do is talk with them about a solution on how we can actually put TVs about the size of this on the factory walls that just show in a typical graph of the current statuses of the different lines, the productivity of each of the 3 shifts. Believe it or not, they have a tolerance. A shift should be able to produce this between this and this amount of product each shift. And they would find that some were drastically lower, but it was hard for them to actually have a clear vision of where they were in their production versus the other shifts. So just even putting that on there kept teams more accountable, because they could see, okay, here's where we are in the tolerance, red, yellow, green, and we can see the other shifts were here, we're here. And they knew they needed to step it up because they'd be held accountable for it. And then also, one of the things that they were most excited about was just the predictive nature of things, being able to say, okay, look, some of their competitors were doing things with augmented reality and some of the big kind of goggle solutions where if something broke down, they could put on a big headset and they could walk around the factory and somebody else in a remote location could see what they're seeing. That's one way to do it, but they said, well, what if we could fix things in advance, right? And that's some of the powers of the cognitive solutions, is being able to take action before you actually need to take action. So the food manufacturing, they want to reduce the operational costs by decreasing the amount of downtime they have, identify how to increase assembly line efficiency, and overall increase profit margin. So one of the ways that they're increasing their profit margin was reducing waste. So actually having a clear view, and that's one thing they didn't have. They could see literally a pile of waste on the floor. It was product that was too small. And it would just kind of collect here, and after a while they come by, scoop it up and toss it. But they didn't know how much waste is there. So giving people clear views into their actual environments is really kind of eye-opening even for us as a provider. Yes, Victor?
Just now, were you talking about like tangible waste, or I thought you were talking about operational waste?
In this case, it was actually tangible waste. There's always tons of operational waste. And there is interesting ways to monitor that and identify that. But in this case, it was just the fact of nobody could tell you, because even though it's tangible waste, it all has a dollar value. How much are we losing? And then figuring out how you're losing that, being able to reduce the amount that you're losing, which means it's more product that's actually going out the end of the assembly line into trucks. So search-driven analytics, and this is actually, when we talk about cognitive analytics and having the AI engine actually be able to correlate all of your data, we actually interacted with it on a search-driven level. So that's where we use the power of AIs to make sense of the data, and allowing somebody, in the case that we just talked about with the food manufacturing, the executives would come in the morning and they would want to know, why was my line down last night? Or why was shift 3 producing X amount of items less than the other 2 shifts? Nobody knew the answer, and what do? They're calling the managers, hey, what happened last night? They get some kind of answers that may or may not be fully true, right? And everybody wants to make sure that they look okay. So this actually gives the management team and the C-suite level people the ability to actually just query the data itself, not just a dashboard, but actually ask questions. And once you get that answer, you can dig down and ask a deeper question. Have you guys ever heard of the 5 whys? Okay, you've heard of them?
Yeah, for Lean Six Sigma.
What's that?
From Lean Six Sigma.
Yeah, exactly. The idea is, essentially, if you want to get down to the base of a problem, you ask why 5 times. You're not like a kid, why, but a little bit more intelligently, right? But ultimately, you can drill down into the root cause of an issue, right? And so that's what the search-driven analytics kind of gives you the ability to do. Is you can ask a question, when you have that answer and you have a different question, you just type it into your search. And it's essentially giving you basically Google-like capabilities on top of your data. One of our value adds is the natural language voice integration. And that again becomes very powerful because having the ability to be in a conference room like this, we're looking at some dashboards on the screen and somebody has a question. If it's not answerable on the dashboard, what do you do? If you have the ability to just, for example, ask Alexa that question and to get that answer back, it actually saves a lot of time. It's actually really interesting. I was talking with somebody that works for one of the federal agencies recently, and I guess it never dawned on them. They've been there probably 20 years. It never dawned on them on how much each meeting costs. Yeah, you're laughing, but a 1 hour meeting, it costs for them upwards, $6,000 or more for people to sit in a room. Looking at search-driven analytics, a few additional benefits. Having access to real-time data. So as data is collected, especially in an operational environment where you're always bringing in fresh data, whether it's from users putting information on a computer screen or a mobile device, or in the case of like manufacturing environments where you have IoT data is actually being collected and dumped into your data source, having that constant ability, you get easier customer engagement. And what if for example, Amazon or other companies were able to provide you with search-based queries where you can just ask it a question, what did I buy in the last 6 months? You can just ask questions like that and get the answers. Or, in the case for me, I have like a million Apple charges for 99 cents. I could figure out, who's doing this and find out which of my kids to yell at. It's a whole nother story, but different time.
I'd like to thank Philip Simulus for a great discussion and demo. I also want to thank everyone for participating in tonight's meetup. If you want to continue the conversation, feel free to reach out to Philip. If you are interested in sponsoring a future meetup, reach out to me. I look forward to seeing you again next month.